Right. Well, I just want to start by saying thank you to everyone for joining us this morning. We're here to talk about long-term care. As you know, since the pandemic began, a lot of problems with the way that long-term care has been delivered in Canada have been laid bare for everyone to see. The results of healthcare cuts and chronic under-resourcing in our long-term care facilities really have come to a head during the pandemic, and we've seen it here in Winnipeg, to be sure, with perhaps the Maples Personal Care Home standing out above all the rest in terms of an example of what's wrong with long-term care in Canada. And we've heard a lot of political parties and politicians on all sides bemoan the state of long-term care in Canada, but what we haven't seen is a real credible and believable plan for how to change it and make it better. And the NDP is resolved to present that plan and to push for it in Ottawa, so that we're not talking about this years into the future, but we can begin to tell a story of how long-term care is improving and seniors are getting the care that they deserve in our personal care homes. So to carry on that conversation, I want to turn it over now to my colleague and friend, the NDP MP for Winnipeg Centre, Leah Gazan.
Well, thank you so much, Daniel, and thank you everybody for joining us today. I want to start out by sending my deep condolences to all families who have lost loved ones in long-term care facilities. It is beyond time that we provide long-term care where people can live in dignity. Particularly, I send condolences to, families, members who lost people in Mapleview, and certainly my riding at Parkview Place. It is for these reasons that I'm really, really proud that the NDP is taking a bold position on long-term care. It is time that everybody is afforded with care where they can live with dignity, where they are respected, where they are cared for properly. So without further ado, it is my deep honor to introduce Jagmeet Singh, who our leader of the NDP, who is leading the discussion on long-term care along with our caucus. Thank you.
Thanks so much, Leah. And a big shout out to all the work you're doing, Leah Gazan, our Member of Parliament for Winnipeg Centre, and a shout out as well to Daniel Blaikie, our Member of Parliament from Elmwood-Transcona. As a team, we looked at this problem and said, there is something we've got to do. We can't sit on the sidelines. We have to show leadership. And while COVID-19 has impacted everyone, we've seen the impacts. People have lost their jobs. People have lost their businesses. People are uncertain about the future. Children in schools, families, everyone is struggling. But what is the most heartbreaking part of this pandemic is how our seniors in long-term care bore the brunt of it, how they lost their lives in what is a preventable tragedy. So in order to do something about it, one of the things that we found very clearly is that for-profit care is where some of the worst conditions were found. For-profit care meant cuts to staffing, cuts to quality of food, cuts to the hours of care. And that directly meant worse conditions for seniors and seniors who were in deplorable conditions and seniors who lost their lives. So we put forward a plan. And our plan is, first and foremost, to get rid of profit in the long-term care system. Profits should never be before people, particularly vulnerable seniors. And so that's why our plan talks about getting rid of profit in our long-term care system. We want to start with Revera, which is the second largest long-term care provider and at the site of many of the horrible examples that seniors had to live through, particularly in Winnipeg, but across the country. That is owned completely by a federal agency. The federal government has the power to make it public and make sure that seniors are cared for. So that's our starting point. We want to see a care guarantee for seniors, for families who have their loved ones in long-term care, and for workers, because we saw the conditions of work are directly related to the conditions of care that seniors receive. So when we pay workers a good wage, when they have enough hours to work, when there's enough staffing, then seniors are cared for. I heard from so many personal support workers and frontline care providers and nurses who say we simply don't have enough hours in the day and enough staff to care for the residents. And it is not the frontline workers' fault. It is a system that has profited the greedy and has hurt our seniors and exploited our seniors. And we're going to put a stop to it. So to talk more about this, we are bringing in two speakers, and I'm really honored to have the first speaker, Brianne, who is the provincial director of the Manitoba Health Coalition, someone who's been a very strong advocate on this file and many others. And with great honor, I pass the mic to Brianne. Brianne, thank you so much for being with us. The mic is yours.
Thank you so much for having me. And good morning, everybody. Thank you for having me and the Manitoba Health Coalition as part of this event. We believe that for-profit long-term care providers have no place in Manitoba or across Canada, and will take every opportunity to amplify this message with the hopes that action will finally be taken. The situation that has played out across this country in long-term care system, including Manitoba, has been gut-wrenchingly devastating, but has also provided a sobering reality of the deprioritization from governments of the needs of personal care home residents, their families, and frontline workers providing that care. For the first time, the consequences of privatization of care, such as what occurred at Maples and Parkview Place here in Winnipeg, were amplified for all Canadians to see. It laid bare the long-standing systemic issues plaguing the sector. The long-term care system has long been broken and has left Manitobans with a patchwork of seniors care, placing an already vulnerable population in the path of destruction that is COVID-19. The pandemic has magnified what many of us already knew, that market strategies do not work well in health services. For-profit care providers are more fragmented and focused on making a profit rather than providing quality, dignified care. As a result, they have lower staffing, lower wages, and they practice hiring part-time casual to avoid paying out other protections, all of which set the stage for COVID-19. Manitoba and our personal care homes were largely escaped the first wave, and we, along with our provincial government, saw what was occurring in Ontario, specifically at for-profit homes run by companies like Rivera. And yet, when the second wave hit, when the evidence of the dangers of for-profit homes was undeniable, nothing happened. Even as many of us, including frontline workers, residents' families, were sounding the alarm in the province, nothing happened. It took a viral Reddit post from a paramedic whistleblower for our government to listen and act on Maples and Parkview Place. The political jockeying that continues to take place at the expense of what is right and what the evidence and research is telling us is just wrong. This crisis does provide us an opportunity to do better for older adults and the frontline workers who provide the care that they need. And part of that solution is removing for-profit care providers in Manitoba and throughout Canada. We must, as a population, agree that the generations before us deserve and are entitled to dignified, accessible care. Just as we need our frontline long-term care workers to have higher staffing ratios, quality wages, training and equipment access to not only provide that dignified care, but to reduce their incidence of injury, burnout, and exhaustion. Because long-term care workers' working conditions are care conditions. It is time to stop the empty platitudes. It is time for action. It is time to put people before profits. Thank you.
Wow, thank you so much, Brianne. Very powerful words capturing exactly what we're going through right now. And I just want to highlight that the provincial government, particularly in Manitoba, cut healthcare right before this pandemic, which directly contributed to the horrible conditions we saw. And at the federal level, Harper brought in cuts to healthcare, and Justin Trudeau continued those very same cuts, which has put us in this position where our healthcare system is being starved of funding. I really want to thank Brianne and for all her work with the coalition. Very powerful words. Thank you so much. In addition to Brianne, we have someone who's going to share a personal story about the impacts of long-term care, particularly for-profit long-term care. So I want to introduce now Larry. Larry, thank you so much for taking the time to share your concerns, to share your story. It's always difficult to do so. So with honor, I pass the mic to you, Larry.
Good morning, Jagmeet. Let me introduce to you an amazing Canadian, Sergeant Glenn Baillie of the Metropolitan Toronto Police. I call him Dad. My mom and dad were business owners after my dad retired of the Spoken Edge and Happy Bear gift shops in Banff and Canmore. Actually, if you ever went to Sunshine Village to rent skis and you met a person that lit up the room with a smile so infectious and a voice like a foghorn, you met Dad. And Dad was a proud Rotarian, but he made everybody into his business feel like they were part of the family. And my dad was also district governor of Rotary. And I have to talk. We often mention that people in long-term care homes, some have pre-existing conditions. In order to get into a healthcare or a long-term care facility, you have to have pre-existing conditions. For 7 months, I tried relentlessly to stop my dad from being a statistic. Yet on November 11th, my dad was a statistic. He was one of 56 people that died at the Maples, which was the deadliest outbreak of COVID-19 in the province. It is so sad. Manitobans are constantly reminded about the reduction of federal transfer payments directly affecting healthcare in the province. Yet the province provides funding through service purchase agreements with for-profit corporations. Dad is not a commodity for shareholders to make profits. Poor communication, I want to make this clear, started long before the pandemic. Pandemics only just super exaggerate. In early 2019, my dad was falling a lot. So I thought it would be proactive. Proactive saves money, reactive doesn't, because you're trying to catch up. And so what I did is I phoned the rehab department at the Maples, and I was told they're too busy with hip and knee replacements. And I just wanted to stop my dad from falling because he was going to get a serious injury. Sherby shooting, guess what? 4 months later, I was right. My dad had a serious injury. He fell and broke his hip. It appears it costed Manitoba taxpayers more money because my dad went into hospital. And what happened to the for-profit? Well, they kept on making for-profit because that's what it's all about. Due to staff shortages, the phones at the nursing station was rarely answered. And the messages were even more rarely answered. And then something called COVID arrived. Mom and Dad were in a not-for-profit in Alberta, and then Dad came here to be close to me, and he was in a for-profit. What were the differences? Oh, $1,400 a month. And although the staff were great, management were non-existent. And facilities, once we were locked in the elevator after a bomber game, it took an hour and a half before we could get freed from the elevator. And my dad was missing his medication. Do you think we even got a "we're sorry" call from management? No, not at all. We need communication that is clear, precise, transparent, and accurate. Healthcare dollars are limited. So why for-profit corporations are utilized in Manitoba? My father and other residents deserve the dignity, respect, and the same level of acute health care as other Manitobans. We demand the facts, not fiction. As my dad would say, only the facts, Jack, only the facts, because we have learned through government and media and Reddit, truth was not always told. And the Maples, when they asked for help, it was too late. And in closing, my father and other residents in for-profit facilities are not a commodity, and this must stop now. Thank you.
Larry, thank you so much. Larry, you breathed life into what is otherwise considered just a number or a statistic. You breathed life into your father. into his legacy and his memory. And thank you for doing that. There was an event held in Parliament organized by activists raising the alarm about the loss of life in long-term care. And they put about 1,000 shoes, empty shoes, on the front lawn to show that these are people that we're losing. These are loved ones that we're losing. These are smiles around the dinner table that we're losing. And I really want to thank Larry for bringing that human story to remind us all that this is about the loss of our loved ones and losses that can be prevented. Big thank you again to Brianne and to Larry for sharing your time and your stories and your voice with us. Thank you to my colleagues, members of Parliament, Daniel Blaikie and Leah Gazan. Thank you so much for being here. Your voices are incredibly powerful. And now I want to pass the mic to Nina to answer any questions.
Thank you very much. So if you have a question, please use the raise hand function at the bottom of the page, and then we will unmute you to ask your question. Si vous avez une question, je vous inviterai d'utiliser la fonction lever la main au bas de la page et je vous appellerai pour vous enlever sur sourdine pour poser votre question. Alors, s'il y a des questions, je vous invite de lever la main. If you have questions, I invite you to raise your hand. I see we have a question, I believe, from Larry Cush with the Winnipeg Free Press. Please go ahead.
Yes, I'm wondering what would be the cost of bringing all the private operators in Canada under the public system? Have you costed that out at all?
Thank you for the question, Larry. What we've done is we've earmarked a commitment towards this goal of $5 billion to help us along the way. I want to just highlight the question of choice when we talk about budgets, when we talk about the cost. There's a choice that we're making. And there is a cost, of course, to caring for people, but there's also a very terrible cost of not doing anything. And the terrible cost of not doing anything is people like Larry lose their father. People lose their loved ones. And our seniors go through horrible conditions where they do not have dignity and respect. That is a terrible cost as well. So what we propose in our plan, it's a $5 billion plan. We want a task force to immediately get to work to ensure that we remove all profit from long-term care. We apply the same funding principles in our Canada Health Act. Those same principles should be applied to long-term care and to home care. We want to make sure there's a care guarantee for workers because, as Brianne mentioned, and as so many experts have said, when workers have good conditions of work, seniors have good conditions of care. It is completely connected. And with Revera, right now, the federal government has the ability to make Revera public. It is fully owned by the federal government. This is a cost we cannot afford to not make. This is a decision that we have to make. We have to decide once and for all that our seniors and our loved ones, people who are vulnerable, people in long-term care, deserve dignity, respect, and the best care possible. And here is a path and a plan to achieve that.
Larry, do you have a follow-up?
Yes, I guess I'm wondering also, is this like a campaign style promise, if you will? Are you anticipating an election this spring?
Really appreciate the question. I want to be very clear on this point. Justin Trudeau should be focused solely on getting vaccines, securing the supply and the doses required, and the delivery of those vaccines into people's arms. That should be the sole focus of the Prime Minister. But it looks like he is putting effort towards planning for an election. He turned an opposition day motion into a confidence vote, something that has almost never happened, if ever happened. It's clear that he's looking for an excuse to go to an election. So we are not going to give him that excuse. We're going to continue to fight for people. If he does choose to go to an election, we are ready for one. This is a campaign commitment. This is a commitment because we want to draw attention to the plight of seniors in long-term care. And we hope the government acts. Take our plan and start getting to work. Listen to all the experts who say we need to get profit out of long-term care. Be the leaders, as Tommy Douglas was, who brought in universal health care across our country at the federal level. That leadership led to the system that we're so proud of today. But let's invest in it. Let's lift up seniors. Let's increase investments in healthcare, but specifically long-term care and home care. And that's what we're hoping to do with today's announcement: raise pressure, increase awareness, and fight for our seniors.
Thank you very much. I would just like to repeat that if you have a question, you can use the raise hand function at the bottom of the page. Si vous avez une question, vous pouvez utiliser la fonction lever la main au bas de la page. Alors, je vais attendre encore quelques secondes. I'll wait for a few seconds to see if there will be other questions. I see no more questions, Jagmeet. I see another question from Larry with the Winnipeg Free Press. Please go ahead. Please unmute to ask your question.
By involving Winnipeg MPs in this announcement, are you targeting Winnipeg seats or Manitoba seats in the coming election? Do you feel that there's room for growth in Winnipeg in Manitoba NDP numbers?
We wanted to do this event in Winnipeg because of how horrible the losses have been in Winnipeg. We heard really horrible stories shared by Daniel and by Leah about what was going on in long-term care. Incredible reporting and whistleblowers who raised the awareness about really horrible conditions. So we wanted to raise awareness that this is something we can do something about. We can't sit on the sidelines. We have to act now. We have to save our seniors. So that's really important. And I think Canadians have seen throughout this pandemic that we've been fighting for them. We fought to double CERB. We fought to get help to students. We fought to increase the wage subsidy. And we brought in paid sick leave, the first of its kind at the federal level. So the same way we fought for people in the pandemic, we want folks to know we're going to fight for them and their seniors and seniors and their loved ones. And we want people to know we will be there for them. So there's folks that see us as their champion. We want to let them know we're going to continue fighting in the same way for seniors and residents of long-term care.
Larry, do you have a follow-up?
No, I think that's fine. Thank you.
Thank you very much. I don't see any more questions. Jagmeet, I will pass it back to you.
Thank you. Once again, I want to thank everybody on the panel today. I want to thank our members of Parliament, Daniel Blaikie, Leah Gazan, and I want to thank Brianne for her advocacy as a part of the coalition. It's done an incredible job, and your powerful words today. Thank you so much, Brianne. And again, I want to thank Larry for breathing life into what is otherwise sometimes resiled as just a number or a stat. These are loved ones that we're fighting for. I want to again reiterate that the provincial government of Manitoba made a horrible decision, a heartless decision to cut healthcare right before this pandemic. Cutting nurses the way they did has put people in a worse condition. They are to be blamed. And the federal government, Justin Trudeau continued the very same cuts to healthcare brought in by Harper, and that has led to the starving of our healthcare system. The reduction in resources is directly attributable to the cuts at the federal level. And I want to make it clear, leadership means not standing on the sidelines. We have an opportunity now to save seniors, and we've got to get to work. We've got to remove profit from long-term care. We've got to lift up the quality of work for the workers, increase staffing hours, a care guarantee for everyone involved, and make sure we build a long-term care system and a home care system that cares for people, some of the most vulnerable people in our society. They deserve nothing less, and we are going to fight for them.
Thank you very much. This concludes our press conference. Ceci met fin à notre conférence de presse. Merci.